You, you
All
can go.
right. Good morning, everybody. Thank you for joining us. Can everybody hear me? I hope so. I was having phone headset issues earlier this morning. So today we're going to be talking about durable medical equipment fraud and how to prevent and report it. So as I get started, of course, I hope everybody knows what durable medical equipment is. Well, there we go. Okay. Okay. So what is durable medical equipment, or DME for short? Of course, durable medical equipment is equipment used that must have a usable life of at least 3 years. It should be used for medical reasons, not not useful to someone who is not doesn't have an injury. And of course, this is stuff that can be used in the home. Of course, it can also be used outside the home also. So some examples of DME, of course, most of y'all know what durable medical equipment is. We're talking about wheelchairs, walkers, canes, crutches, oxygen equipment, hospital beds, all of the braces, the artificial limbs and eyes, the diabetic supplies, and the diabetic shoes or therapeutic. So that's some examples of what DME we're talking about. So DME actually has marketing guidelines that the companies have marketing guidelines that they have to follow, and some of these durable medical equipment suppliers need to be reported if they are not following these marketing guidelines. Some of the guidelines are they must not use symbols or anything like that, or names reference to like CMS or anything like that. And they cannot drum up business by doing unsolicited telephone calls. And I'll be talking about those a little bit later. Sorry, wrong direction. So they cannot make unsolicited cell calls. They cannot go door to door trying to sell these products. They can't just show up at people's houses. They cannot offer these services for free and then bill Medicare. That's some of the other problems that I've dealt with before. They can't be told that they're free and then get their Medicare numbers because they're going to bill Medicare for those. So also some things to be aware of these aggressive marketing suppliers. I said they're not supposed to be cold calling people. When you go out and talk to the beneficiaries, please make sure that if they do get these calls, see if they can get as much information from them as possible. Of course, there is that scam that's going around. I'll talk about a little bit later. But things don't persuade. Like if they're using a certain supplier and they get a phone call from a different supplier and a different supplier is trying to get them to switch, that's definitely a no-no, and that other supplier needs to be reported. So don't let the other suppliers try to get you to switch by saying their products are cheaper or save you money, whatever they try to tell them. I said make sure remember that Medicare or anybody does not send these representatives out to their homes. So don't be influenced by all these advertisements that they see on TV. I know one gentleman that I've been dealing with here lately. He saw an advertisement for a back brace in, I think it was a Parade magazine or whatever. He called and gave them his information, and now they sent him to. He's gotten stuff from 4 different DME suppliers just by making that one phone call. 2 of them sent him back braces. The other ones had sent him other kinds of braces like leg braces, ankle braces. I mean, it's unreal what he's dealing with just by calling that one number that he saw in an advertisement in the Parade magazine. So he's got all this headache that he's having to deal with. And I said he's gotten, braces from 4 different people when all he wanted was one back brace. So that's the issue right now. We're having a lot of issues with the durable medical equipment. And it's not just the suppliers. Somehow these call centers, when they get their information, they're sending them out to as many, once they get that information, they're sending it out to as many durable medical equipment companies as they can. So I don't know and how they're doing this, but CMS is aware of this issue. But hopefully we can help stem some of the beneficiaries from doing this. So there are some exceptions to the DME marketing rule. One of the exceptions is if the beneficiary is given written permission from the supplier to contact them by phone. For example, if they've gone to some kind of health fair and the DME people are set up at a booth and they fill out one of those cards, they're giving them pretty much permission, giving the company permission to call them. Another thing, they can contact a Medicare beneficiary if they have furnished, them supplies in the future or supplies currently or in the past. So keep that in mind. So when is DME covered? DME is covered if it is medically necessary, and that's a thing that the doctor has to document that the durable medical equipment is medically necessary, or Medicare will not cover it. Also, it has to be something that's going to be used in the home. For example, if they're using a home a walker in the home and they're wanting like a scooter or something, and they're only going to be using the scooter for outside, that's not something that Medicare will cover. Another thing that Medicare covers durable medical equipment under Part B, unless someone is in a hospital or skilled nursing facility, and then that should be billed in with their fee from the hospital or the nursing facility. So that should be included in with those fees from the hospital or nursing facility. So that's the only time that durable medical equipment is not sent to the claim for under Medicare Part B, as in boy. So, and of course, Medicare will only cover DME that is provided by a Medicare-approved DME supplier. Of course, if someone is looking for a supplier, you can go into the Medicare, .gov website and look up a supplier in that area. And you need to make sure that supplier takes Medicare assignment, so that they're not having to pay more than what's necessary. So how much does Medicare, the DME cost? Of course, as I said, the DME supplier needs to accept Medicare assignment, which, of course, Medicare will pay 80% of the cost, and, the beneficiary is responsible for the other 20%. That's after they have paid their Part B deductible. So keep in mind the Part B deductible. They have to pay that first before the 20% actually kicks in. Of course, they may not have to pay that 20% if they have a supplement or something like that. That will cover that 20% for durable medical equipment. Also, another thing that beneficiaries need to look out for, and you need to remind them if you're doing any counseling, that if they're on a Medicare Advantage plan, all DME that's covered by original Medicare should be covered the same, have the same items available under the Advantage plan. But, the costs with that plan may be different. So, some Advantage plans, may only pay, 90% or something. So they have to follow their plan's rules and regulations. For example, they may have to go to an in-network supplier. Make sure that they go to an in-network supplier. If they don't go to an in-network supplier for these Advantage plans, they could be paying full cost for whatever that may be that they're getting. So they have to follow their plan's rules and regulations. So durable medical equipment and fraud, how can they prevent fraud? Make sure that if they get these phone calls from these DME suppliers, that they do not give their information out over the phone, especially the new Medicare cards. And if they do get calls from a DME company, please let me know so that I can report that DME company, so that other people won't fall victim to these the unsolicited telemarketing, so we can get it stopped. Another thing, that suppliers must maintain a physical address that is open and accessible to the public. They can't be. They have to have these. I mean, some in the past, OIG has busted DME companies. They're operating, out of someone's house or something like that. But they have to be open and accessible to the public. The facility must be staffed and accessible during posted hours of operation. They must have a business telephone number. It can't be a cell phone number. So if you're out there and you see anything like this, please let me know. So exactly what is DME fraud? Of course, this is billing for equipment that was never received, billing for equipment that is different than what you received, billing for more advanced equipment than what you actually needed, or giving false or misleading information. For example, if they did tell them that this is free and then they're trying to bill Medicare, which happens all the time. So how can we prevent fraud? One big thing about how to prevent fraud is understanding what Medicare actually covers. There is some durable medical equipment that Medicare does not cover. For example, the convenience, things that Medicare considers as convenience items. For example, like the handholds, the potty, the thing that goes over the toilet, the shower chairs. All those are considered convenience items. So Medicare does not cover them. So you need to understand exactly know what Medicare covers. Also, another reason how know how your DME is, how to get your DME covered. Know how to actually get it covered. Oftentimes, like a provider must document that a face-to-face visit occurred in order for Medicare to actually cover that service or that item. And the face-to-face must take place no more than 6 months before the prescription is written, because the doctor actually has to write a prescription. So that's just some things that understand what Medicare covers and know how to get it covered. As I said before, Medicare will not pay for something if they're in a skilled nursing facility or inpatient, because that's actually supposed to be covered through their payment with the facility. I encourage beneficiaries, if you do need a back brace or anything like that, please do not call those numbers that they see advertised on TV and through anything. They need to go to their physician to get a prescription. And the physician actually has to say that it is medically necessary. Again, how to prevent fraud: only use a DME supplier that takes Medicare assignment, because these, the ones that take Medicare assignment actually have a contract with Medicare that they're only going to charge a certain plan. And another thing, they need to stay in network if they're on a Medicare Advantage plan, and they have to follow the Advantage plan rules. So that's another reason how they can actually prevent fraud. So of course, y'all probably heard some of the competitive bidding. That happened in the past, where you could only, if you lived in a certain geographical area, you had to use these certain suppliers for these certain things. Well, of course, the competitive bidding actually expired on December 31st. So you all don't have to follow those competitive bidding contracts anymore. So as of January 1st, there's a temporary gap in the entire DMEPOS competitive bidding program, and it's expected to last at least until December 31st, 2020. And I'm thinking, just based on this, and I haven't seen any referrals like this, and I'm hoping it's not going to happen, that since this competitive bidding is gone, that we may see a rise or increase in fraud where other suppliers are trying to call people and things like that. I'm hoping it's not going to happen, but if it does, please let me know. As I said, I haven't heard anything from that, any new referrals regarding that. So some of the DME scams that I'm seeing out there, that I've gotten, the one big that's really big right now, that is actually a nationwide issue, it's not just in Tennessee, is this brace scam, where beneficiaries are getting phone calls from either someone claiming to be from Medicare and that can provide them a free brace for their pain. Calls just asking about their pain, doesn't even say who they're with. So that's the two type of brace scams I'm seeing out there. And I said, and this one gentleman, even out this advertisement in this Parade magazine, just making that one phone call, he's gotten, more braces than he ever needed or even wanted. He just wanted one back brace. So please, their scammers are out there hot and heavy, and these beneficiaries are getting multiple calls a day regarding these braces and claiming to be from Medicare and things like that. The only problem with these is that we don't know where this telemarketing or this call center is, because they're spoofing the phone numbers. So we can't backtrace where they're actually calling from. So that's the other thing, that they're spoofing these numbers. Scammers are spoofing these numbers, and they're looking like they're local numbers because they're using like local, area codes and things like that. So the beneficiaries are actually picking up the phone, and of course, if they're saying they're for Medicare, they're thinking they're for Medicare. And oh yeah, it's Medicare. I've got some back pain, and if Medicare's offering me a free brace, then, yeah, go ahead and send it to me. And then they'll give out their Medicare information over the phone. I've had two individuals I got one of these calls the other day, and they gave out their information, the new Medicare number, over the phone. And the thing is, they saw something on the news about the brace scam that night. Then they called me the next morning. So now I've had to report their new Medicare numbers as compromised. Of course, thankfully, with the new Medicare cards, Medicare can actually issue them a new number. That's a good thing. So hopefully, and I've also sent them to the OIG as having their Medicare number compromised. So hopefully, with the new numbers, it's going to be harder for the scammers to actually get something charged on the Medicare. Hopefully, we're hoping, if they can get their new numbers, if Medicare can issue their new numbers in time. But things like that, they're happening. I'm getting calls like this on a daily basis about this brace scam. And beneficiaries are getting really tired of getting all these calls. And the thing is people keep telling me, well, I'm signed up for the do not call list. I'm signed up for the do not call list. And I have to keep telling beneficiaries, scammers do not follow that do not call list. They're committing a criminal act anyway. So of course, criminals do not follow that do not call list. So it doesn't matter. So if you are on that do not call list, the calls that you're getting are most likely scams. So don't answer those. If you have a caller ID, don't answer those phones. Don't answer those. Or if you do answer it, don't say anything. Especially do not give your information out over the phone. That's one thing with the brace scam, is telling beneficiaries, please do not give your information out over the phone to anybody that calls you unless it's SHIP. And most of the time they've called SHIP in the first place. Diabetic supply scams. These are numerous. So I've had one where a gentleman was using one certain diabetic company, and this other one was calling him, trying to get him to switch, or sending him free supplies, trying to get him to switch. So, that's some of the issues with the diabetic supplies. Also, those free meters, they were calling. I had one beneficiary call me that wasn't even diabetic, and they were offering her that free meter Uh, but I mean, she wasn't even diabetic. So that's the other type of diabetic scams that's out there. Of course, y'all know about the power wheelchair, the scooter store. While the scooter store is no longer in business, they were trying to, they were falsifying documents to get people into a scooter so Medicare would pay for them. So those are those type of scams. Of course, Medicare with the power wheelchairs now, or Medicare has to actually pre-approve those before they will ever get before Medicare will ever get them paid. So there are steps that the suppliers have to go through before Medicare will ever approve the chair. So that's another thing that beneficiaries need to be aware of. There might be something that has to be pre-approved by Medicare before they will ever pay it. So I know I was quick, trying to go over my notes here to see. Of course, types of kind of equipment and supplies Medicare does not cover. I'll go over those, what actually Medicare does not cover. Medicare doesn't cover equipment mainly intended to help you outside the home. Medicare does not cover a motorized scooter that you only use outside the home. So the beneficiary actually has to use it inside the home. Of course, most items intended only to make things more convenient or comfortable. Of course, the chairway, elevators, the grab bars, air conditioner, bathtub, and toilet seats. So all those are considered convenient and comfortable. Items that are thrown away after use or that are not used with equipment. For example, Medicare does not cover incontinence pads, catheters, surgical masks, or compression leggings. Of course, however, if you receive home health care, Medicare pays for some disposable supplies, which includes the intravenous supplies, gauze, and catheters. So that's if you have home health. In some cases, Part B also covers surgical dressing and supplies obtained from a supplier. So it's not just in some cases. Another thing, catheters may be covered as a prosthetic if you have a permanent condition. So the beneficiary has to have a permanent condition. Some other things that Medicare does not cover, ramps, widening of doors, and things like that for wheelchair access, and equipment that is not suitable for use in the home. For example, some types of them are used in hospitals or skilled nursing facilities, like the paraffin bath units and the oscillating beds. Medicare does not cover. So they need to make sure that what they're getting is something, one, that Medicare will cover. Make sure they're getting it from a Medicare a supplier that takes Medicare assignments. And just to make sure that if they're not sure if it's something Medicare will cover, they need to ask the supplier. Or they can call 1-800 Medicare to find out if something Medicare will cover. Okay, and now I was gonna, of course, and the thing is, if you do talk to a beneficiary and they've seen or done something, like one of these suppliers has done something they're not supposed to, please report it to me. So that's the big things that beneficiaries need to remember is, one, they need to protect their information. They need to detect a fraud by reading the Medicare summary notices, and then they need to report it to me. So as I said, how they can protect their information, don't give it out, and I keep harping on this. Please, please, please do not give your information out over the phone to anybody calls you. As I said, I get calls daily from people where they've given their Medicare numbers out to people that have called them. Don't carry your Medicare card unless you actually go into the doctor or something like that. They need to treat their Medicare card like it's a credit card. Another thing, knowledge is power. Knowing how these scammers operate, can stop them. Most of the scammers are operating through the telephone. That's the biggest one. Make sure that the advertisements, the TV advertisements, and the articles in the papers, that's how the scammers are operating. So please don't fall victim to these. So how can they actually detect fraud? Of course, they need to read their Medicare summary notices explanation of benefits, and watch for services or supplies they didn't get. Services or supplies are not that weren't ordered by their doctor. Billing for the same thing twice. For example, this beneficiary, he got billed for the same thing twice, but it was from two different suppliers. And so that they need to, I encourage beneficiaries to please, please, please read your Medicare summary notice explanation of benefits. Another thing, if they do find something, please give me a call. You call me, send me an email, anything. If they've got questions or anything like that, please. Or if they see something suspicious. Another thing that OIG is asking us to do if they do get these issues is to help people file an appeal. And of course, I've taught you all, if you're a volunteer, I've taught you all how to file an appeal. All you have to do is find the very last page of the Medicare summary notice and follow those steps. That's how you can file an appeal. So I encourage beneficiaries, go ahead and file an appeal. Also to report it to me so that I can report it to the proper authority. So we're hitting it with two ways, which is a good thing. So maybe we can get some of these things stopped. But definitely file an appeal if they get something on their Medicare summary notice that shouldn't be there, or a back brace they didn't order, or something like that. If they do get that, please go ahead and help them file an appeal, and then call me, and then I can report it to the OIG. So we're hitting them two ways. And of course, another big thing: pass this information along to as many family and friends, church people that you can, especially these scams that's going around. Please pass this information along, because I need to hit as many beneficiaries as I can so they don't fall victim to these scams. So I was going to do some case studies. I'm going to make okay. The first case study, her name is Judy. Judy has original Medicare. She has recently developed mobility issues and is having trouble getting around her home. She believes that she needs a power wheelchair, but does not know how to get it covered by Medicare or what she will have to pay. So, what should Judy do? Anybody? Y'all want to type in some of your answers? Okay, yes. Alice typed in to call her doctor. Yes, that is where Judy needs to start first, is to call her doctor. Of course, if she doesn't know what to do first, of course, she can always call SHIP first, and then, SHIP can actually walk her through and what she needs to do. Yes, so, but if she doesn't feel, want to call SHIP, then the very first thing that she should do is talk to her doctor. She'll probably have to go in to do a face-to-face. And then, once the doctor determines if it's medically necessary, then the doctor can, help her find. And yes, Carol, she's got to get a prescription from the doctor. And then the doctor has to find, can give her some authorized companies. Now, keep in mind, a doctor cannot just say you have to go to this certain supplier. That is a no-no. The doctor can say, here's you some suppliers, or I've had another, beneficiary use this supplier, but the doctor cannot just say you have to go to my supplier. That is a no-no. Of course, yes, Andrew said if she's an MA plan, yes, she needs to find an in-network supplier. Now, keep in mind, with a power wheelchair, Medicare has to get pre-authorization, or the supplier has to get pre-authorization before she'll ever get the chair. So once she gets that prescription from the doctor, or the doctor can actually call the supplier themselves. whichever one the beneficiary decides to go with. Um, so the provider should write a prescription or order for the power wheelchair that details, that's the thing, duties need for a power wheelchair. And of course, the doctor can send that to the supplier, and then the supplier can start the pre-authorization process. And this is something that is actually required in Tennessee to get pre-authorization for. Of course, the supplier can then send a request for prior authorization to the DME MAC, and that details duties need for the power wheelchair. So it's a process, especially for a power wheelchair. Yeah, another thing, Gloria said that yes, to make sure the item is definitely covered. Yeah, make sure that, if it's something and that's where she can call SHIP to find out if this is something that's actually covered, or she can call Medicare or something like that, or, her primary care physician. Most of the time they know if it's something that's actually covered. And that's the doctor can help find the supplier that takes assignment. So here's the next one. Y'all did very good on that one. Okay, the next one is Stavros. He has original Medicare. After a major injury, he was in a wheelchair for several months, but he has recovered, and he returned his wheelchair to the medical equipment supplier 2 months ago. He just received his Medicare summary notice in the mail the other day, which shows that the supplier has billed Medicare for a wheelchair rental for the last 2 months after his equipment was returned. So what should Stavros do? Sorry, guys, my phone's ringing. Yeah, that is correct. Adrian, yes. She needs to contact the SMP and the supplier. Best thing I try to tell beneficiaries, I ask them, for the very first thing I ask them, have you contacted the supplier so that they can correct their mistake? That's the very first thing I ask the beneficiaries, if they've actually contacted the supplier. If not, then I will go ahead and contact the supplier for them to see if I can get it corrected. Because sometimes it may just be a billing issue where he may return it to the home office, but the home office may have forgotten to let the billing people know. Because most time the suppliers actually contract out their billing, so they may not let the billing company know that it was a return. So things like that does happen. Yes, Suzanne, he can also file an appeal with Medicare. I highly encourage them to do that also. That way, hitting it with both ways. So they can file an appeal, call me, call the supplier. So yes, very good answers, everybody. Very good answers. Okay. So, and that's another reason how he saw that. If he hadn't looked at his Medicare summary notice, he wouldn't have known that. And then Medicare, would have gone ahead and paid for 2 months for a rental he actually returned. So that's why it's very important for individuals to read their Medicare summary notices. Alrighty. So I'm pretty much done. Has anybody got any questions? And Vivian, can you? Okay, and I've got let's see here, someone asked me. I do have one question that somebody submitted actually yesterday. And someone asked me yesterday, does Medicare pay for shower chairs? No, Medicare does not pay for shower chairs because they consider that as a convenience or comfortable item. Okay, and so Nancy's put in, but can you discuss meds for DME? My understanding that those medications are through Part B. For example, yes, some medications, Medicare does pay for some medications that actually go in durable medical equipment. For example, albuterol for a nebulizer. Yes, that is actually billed under Part B. So when individuals go to a pharmacy to get their albuterol, they need to make sure that they tell the pharmacist this is medicine going into a nebulizer. Also, that they need to go to a supplier that actually accepts Part B. And we've had this issues before. Also, the insulin. They need to make sure that they tell the pharmacist that this insulin goes into an insulin pump, because if that's connected to their site. So insulin and albuterol that goes in nebulizers and insulins for pumps, yes, is built under Part B.
Part B. Okay.
And Medicare needs to, the pharmacist, the beneficiary needs to make sure the pharmacist understands that these are items going into durable medical equipment. Because I had one individual, and also they need to go to a supplier. For example, we've had some issues with one certain supplier that does not take Medicare Part B. They are a Part D supplier for Medicare. D is in drug, but they are not a Part B. It means they do not take Medicare assignment for Part B. So the beneficiary was actually having to pay more out of pocket and then try to get reimbursed through submitting the claim to Medicare themselves. Of course, as I said, if they do not take Medicare Part B assignment, then they can be charged more or full cost, and they would have to submit the claims themselves. So that's why they need to make sure they're going to a supplier that takes Medicare Part B assignment. I said we've had that issue before. Should we? Nancy said, should we include those on the Part D comparison? No. If they are taking albuterol and insulin for an insulin pump, then no, those do not have to be included on the Part D comparison, because they're not being submitted through their Part D as in drug. They actually should be submitted through their Part B. So Nancy, does that answer your question? I hope so. Okay, I have a possible fraud question, but it's not about DME. Sure. Okay, someone has a. Sure, Alice, go ahead and type in your question. Okay, there's some ads that say it is free to you. Is that legal? They don't just say that the item is free. It depends on how it's worded after that, I guess. So, I mean, because some DME companies, they are, supposed to charge that 20% that Medicare doesn't cover unless Medicare covers it at 100%. So it is not totally free. And it's not free to you, because if they are not charging that beneficiary that 20%, that is actually illegal also. So we need to make sure that, those ads are free, and I can always submit those ads on up the line to let the DME contractor know that, these ads are out there, and let them determine if it's legal or not. So if you all do see something like that, please let me know. Take a picture of it, send it to me, whatever, so that I can pass it on. Okay. Bear with me. Are sleep apnea mouthpieces considered DME? Okay. What do you mean by mouthpieces? Is that sleep apnea mouthpieces? Are you talking about the mask? Like the mask that goes over their nose and mouth? Or are you talking about some kind of different kind of... Adrian, I'm not understanding what you mean by mouthpiece.
It goes in the mouth.
Does it go over their nose too? Is that the thing that the air is coming through? That's what I'm not sure. Or are you talking about something that where it keeps them from grinding their teeth or something? Is it if it's hooked up to the CPAP machine? It depends on what it is, I think, as if it could be considered DME or not. I know, like the mask and things for that goes with the CPAP machine are considered durable medical equipment. I'm not sure about this mouthpiece. Does the air go through the mouthpiece? Because I think if the air goes through the mouthpiece, I think it would be considered part of DME. I'm not sure. As long as it's connected to the CPAP machine, I think that's the thing. It has to be connected to the CPAP machine somehow. Then I think it would be covered. Of course, that's a thing that we may have to ask Medicare. Got another question. A beneficiary moved from Arkansas in February. Well care agent signed her up for well care while she was in Arkansas. She said she told him she was moving to Tennessee, but he said no problem. Now she is getting letters from WellCare saying they are going to disenroll her because she is not in the service area. Well, and she has no coverage. Can we report? Okay. Alice, I may need to email you. Alice is asking about an agent signing someone up for well care while in Arkansas, but then she moved. Wants to know if we can report that agent. I really don't know. I'll have to check into that, Alice. So we'll I'll have to email you on that.
You have a question from Allie also, Lonnie.
What now?
There's another question from Allie.
Okay. It's not part of the CPAP machine. No, probably not. It helps move the jaws forward. No, that's probably not considered DME then. Adrian, if it's something that helps move the jaw forward. Sounds like their jaw's out of line, and that's for the like TMJ or something like that. No, I don't think that would be considered DME. Okay, Allie, question from our group. An individual was living in a skilled nursing facility and was forced to only see the skilled nursing facility MD, not allowed to go see her PCP. She was told she would qualify for a WC, not a hospital bed. What's a WC? Wheelchair? Is that wheelchair? Not a hospital. 2 questions. Is it illegal to be forced to only see their MD? And also, what do you do if you believe you need more DME support than what the prescribing MD recommends? Okay, it depends on the skilled nursing facility's rules and regulations. If the rules and regulations of that skilled nursing facility, I mean, it really depends on the rules and regulations of what they say. Because if like when you sign, I mean, you have to sign that you're going to follow their rules and regulations when you're going into this facility. So that's why you really need to look at those rules and regulations before you ever decide to go to a skilled nursing facility. But also a skilled nursing facility, I think they can't deny you, I don't think, from going to your primary care physician. Because if you're in a skilled nursing facility, you can get checked out. Someone can come check you out to take you to your primary care physician, to the best of my knowledge. But as I said, I don't know the rules and regulations for that skilled nursing facility. We'd have to look at those first to see. Also, what do you do if you believe you need more DME support? What do you mean by DME support? And what the prescribing MD recommends? I mean, you can always get, beneficiaries can always get a second opinion. They can always go to a different doctor. They can always get another opinion. I said, unless they're on an Advantage plan, and then if they're having issues with a doctor on the Advantage plan, they can file a grievance against that physician if they're on an Advantage plan, and the Advantage plan can handle it through that grievance process. Also, if someone's having issues with any of the DMA, there's actually a durable medical equipment ombudsman that beneficiaries can use. They would have to call Medicare and report the issue with Medicare and tell Medicare that they want this issue submitted to the Medicare ombudsman, the DMA ombudsman, because they're having issues. So they can also use that person. Another is an MD allowed to recommend a DMA supplier? I mean, they can recommend, but the person doesn't have to actually use that supplier. They can, go around and look at other suppliers. As I said, the doctor cannot say that you have to use this certain supplier. That's definitely a no-no. They can use any supplier because the doctor can just write them a prescription, and then they can take that prescription to any supplier that they want to. Also, can cost increase during the rental period of a DMA after obtained? That can change year to year. It depends on when, because I know the contracts with Medicare, they evaluate those every year. The prices could go up. That is true. As it depends on what the supplier contract says with Medicare, and they evaluate those. Could be on a yearly basis, so that the contract, the price actually could increase. It may not be a large increase, but it could be just a little bit. Of course, it can increase after it's obtained, yes, because it's a rental. And if Medicare's contracted, that the year before, they could increase their rental amount the next year or something, or whenever that contract is. So yes, that actually can happen. Okay, that's what I thought, wheelchair. Okay. Yeah, if that, if you qualified for a wheelchair, but not, I said if she's having issues, then there's several different ways that they can go about. Call Medicare, ask tell them the issue, and that they want this sent up to the Medicare ombudsman. If they're on a Advantage plan, they can do the grievance with the Advantage plan. Of course, they can, if they're in a skilled nursing, make sure that they're not violating the rules of the skilled nursing. They can go to another provider if they want to. Any other questions? Y'all got some really good questions. No? Okay. I've got two in the room with me, so I've asked them if they had any questions. Do y'all have any other questions? All right, I just want to reiterate, please, make sure that if their DME, make sure that it's something, one, that Medicare pays for, so they may need to do a little research or call Medicare to make sure it's something that's paid for. Make sure that they go to a supplier that takes Medicare assignment, so it's not costing them more. Make sure that they follow, if it has to be pre-approved, make sure it gets pre-authorization, things like that. If y'all have any issues, if you find anything, make sure beneficiaries, if they're talking to beneficiaries, make sure they're reading the Medicare summary notices and reporting these scams and frauds, especially if they fall victim to them. and if they've given out their new Medicare card numbers, make sure that they are reporting this to me so that I can report their new number as compromised. So does anyone else have any other questions? Of course, y'all have got my information. You all can contact me through my toll-free number, my office number, my email. Keep in mind that, spring is coming and Vivi and I will be out traveling a lot, doing update trainings and things like that. So, sorry. Just please keep in mind, a good way to get in contact with me is by my email, because I can check my email from anywhere. So I want to thank you all for letting me speak with you all today. Does anyone have any other questions before I sign off or anything like that? Again, if you haven't typed your name in the chat box, please do, so that we can get your sorry. Thank you all. Vivian, you can stop the recording.